and the clinical leadership from all of our 6 Ohio children's hospitals. Many of our superintendents have been reaching out to our children's hospitals to ask them questions, so we thought it would be good to get them all on a call together so that they would have a chance to ask questions and hear what's going on in their part of the state from the point of view of the medical children's hospitals. We are blessed in Ohio to have 6 great, amazing children's hospitals. They are truly our most trusted authorities in regard to the medical care of our children. They shared on that call information about the number of children with COVID in our hospitals, the number of children with COVID in our ICUs and on ventilators. And they also talked about how children's hospitals' ability to care for all children is being compromised because all of our children's hospitals are overwhelmed by the increases in COVID cases as well as the other respiratory illnesses that they're seeing. Just to go back a little bit, on September 2nd, the Ohio Children's Hospitals issued an open letter to all Ohioans asking us to help them protect our children by getting them vaccinated and by wearing masks in school and at large gatherings. 5 days later, on September 7th, they held a press conference to reiterate that message. And again, at that press conference, they strongly recommended that children get vaccinated when they could, when they were old enough to, and when they could not, that they needed to wear masks while in school. Today, they went even further. And today they made a direct appeal to the superintendents, to the schools, and they asked all schools in Ohio, K through 12, to require masks for staff and students during this very dangerous surge of the coronavirus. Now, we all share the goal of helping our kids, keeping those kids in school. Reasonable people may disagree about a lot of things during this coronavirus, but I think all of us, Democrat, Republican, liberal, conservative, I think just about everybody in Ohio now agrees that we must do everything we can to keep our children in the classroom. We need our kids in school so they don't fall behind, so that their parents can continue to work and not have to take time off to be home with the children, and so we don't exacerbate the behavioral health challenges that kids face by not being in the classroom, not being there with other kids. If we want our kids to stay in school, if we want our schools to stay open, the best way to do that is, of course, if the child is old enough to be vaccinated. Adults, that's adults and kids 12 and over. But if a child is too young to be vaccinated, then until we get through this, we need students who come to school to wear a mask. Now let me go to a couple data points which we're trying to follow, and we are following every single day. Let me tell you where we are with those, and we'll go back to that. Let me look at this chart. About 15% of our, Eric, if you go back and pull the chart up for me, please. And we'll go back because I can't see it. Oh, there it is. I'm sorry. So if we look at the chart, we start off with optional, masks being optional for all students. That's 375 of our school districts, 61% of our school districts. But if you look at the percentage of students who are in optional for all students, that is 38.9%. Required, mask required for some students, almost 15%. Mask required for all students, 46%. Now, if we just look at the number of students who are now required in Ohio to wear a mask, that's what the next line is. Required for students, no, it's the next chart, Eric, I'm sorry. So there's approximately 54.4% of our total public school students today who are required to wear a mask. That is a significant increase in the number of students required to wear a mask from when school started today. So I wanted to make sure everyone had those numbers so you could see exactly where we are. Now, let's look at some data about where we are in Ohio. What's really happening in Ohio in regard to the Delta variant. And then after we do that, we'll turn and look at what's going on in regard to the Delta variant with our children. So first, let's look at the increase in hospitalizations among everyone. If you go back to the first week of July, when this Delta variant was starting, we had 203 people who were in Ohio's hospitals with COVID, 203. Yesterday, that number was 3,427 people who were in Ohio hospitals with COVID. That is an increase of almost 1,600%. Just today, there were 344 newly reported hospitalizations. In regard to deaths from COVID, we've seen deaths increase in the state during the Delta surge, with 28 Ohioans dying from COVID in the first week of July when we started seeing cases increase as a result of the Delta variant. But during the last week of August, that number had gone to 147 Ohioans dying from COVID. Again, that is an increase of over 400%. Looking at cases, they're increasing uniformly across the state. Every single county is red hot. Some counties are almost boiling over, but everywhere, no matter where your school district is, they're red hot. There's no place that you can run from the COVID. Every school district is surrounded by numbers of cases that are very, very high. Let me go to the chart. Look at the next chart, Eric. What you will see on here is that every county, if I went to the lowest county, Holmes County, Putnam County, both of them are still exceedingly high. Holmes County is the lowest county, is still at 341 cases per 100,000 for a 2-week period of time. What that means is even the lowest county is 3 times what the CDC says is considered to be high incidence. If you look at some of the highest counties, Pike County, Lawrence County, Perry County, Pike County, for example, is 20 times what the high or was considered to be high incidence. So every single county, every single county, no matter where your school district is exceedingly, exceedingly high. Let's look at some additional numbers. Now let's look specifically at what's going on with our children. Since August 15th, over 29,000 Ohio school-age children have had cases of COVID-19. Cases increased 198% from the week of August 15th compared to the week ending September 4th. The American Academy of Pediatrics just reported yesterday COVID cases among children have increased 240% nationally since early August when the Delta variant started to surge. But during that same period in Ohio, we have seen a 2,000% increase in cases among children. COVID cases are increasing at nearly twice the rate among school-aged children as compared to how they're increasing among the rest of the population. This past week saw a 44% increase among school-aged children and only a 17% increase among the rest of us. And over the 2-week period ending September 4th, there was an average of 909 cases per 100,000 for school-aged Ohio kids versus only 561 cases per 100,000 for the rest of us. Big difference. The 16 highest number of cases per day throughout the entire pandemic for kids aged 5 to 17 in Ohio have all been in the last 19 days. The data is now clear that there is a higher level of COVID in school districts where masks are not required. And that is some very, very significant pieces of information. Let me now go to our guests who are here. And I want to thank our children's hospitals for being here. And let me turn now to Nick Lashutka, who heads up the Ohio Children's Hospital Association. And Nick, I know that you have with you some of the children's hospitals, and please share with us whatever information you all have.
Thank you, Governor. Good afternoon to the media. As the governor mentioned, and as we've shared with you, children and their healthcare providers are facing a perfect storm. It's a combination of COVID driven principally by the Delta variant, which is affecting kids in 2021 in a way that did not happen in 2020. Secondly, there is unseasonably high respiratory conditions that we've never seen in the summer. We're at what we've called peak winter busy with RSV, parainfluenza, rhinovirus. 3, our behavioral health census, which even pre-pandemic was at a crisis, has been on the rise and continuing to rise, both inpatient and outpatient. And the 4th component of this, which you'll hear more about, are key staffing challenges that our institutions, like many other parts of Ohio, are facing. Our message that the governor explained to the superintendents is what we've been sharing with everyone, including you, and that is we believe everyone can agree that our number one priority is to keep children in school in person 5 days a week, and we have the tools that will help us to accomplish that goal, and that's what we shared with the superintendents. I'm pleased to be joined here this afternoon by some of our key children's hospital leaders. We're going to hear first from Debbie Feldman, who is the president and chief executive officer of Dayton Children's, who can give some perspective on the CEO open letter that the governor referenced and that we shared with all of you 2 weeks ago. Following Debbie, we'll hear from Paula Grebe, who is the chief nursing officer and vice president of patient care services at ProMedica Health System, and Russell J. Ebi Children's in Northwest Ohio. Following Paula, we'll hear from Dr. Rustin Morse. Dr. Morse is the chief medical officer here in Central Ohio at Nationwide Children's, who's providing care to not only Central Ohio children, but Southeast Ohio children. And then we'll be followed and concluded by Dr. Patty Manning. Dr. Manning, as you all have heard, is the chief of staff at Cincinnati Children's. And all these folks are happy to answer questions at the conclusion. So with that, Debbie, I will turn it to you.
Thank you, Nick, and thank you, Governor, for letting me share some insights as to what's happening here in the Dayton region, and also on behalf of my fellow colleagues, the CEOs of the other children's hospitals in Ohio. As the governor said, Ohio truly is blessed to have some of the best children's hospitals in the country, and we pride ourselves on meeting the needs of our kids and their families. This is something we believe that we do, and we do it extremely well. But I would tell you that this commitment, this desire is really threatened right now with a surge in demand that has been unprecedented for many of us. We are dealing with a disease that we've all been facing for over 18 months now. And for a long time, it was really perceived as a disease that did not impact our kids in a significant way. Well, that belief has really been shattered over the last several months, and the governor shared a lot of that data. 25% of the cases in the state of Ohio are kids, and we're feeling that in our children's hospitals. We're seeing demands in our emergency departments and our access points at unprecedented levels. Just to give you a little bit of a perspective from the Dayton region, from Dayton Children's, we have been in red bed status here at Dayton Children's 55% of the time since August 28th. Today, we had two beds available in the hospital for children who need them, excluding our NICU and our behavioral health beds. Those children in the bed on any given day in the last few weeks have ranged from about 11 to 17 children that are in the hospital with COVID itself. But they're also in the hospital with a variety of other respiratory and just other needs that children have at Children's Hospital for. The demand at our access points is absolutely staggering. If we compare September 2019 to September 2021, because we really can't use 2020 as a guide because we know it was a very unusual year, our emergency department utilization is up 41%, our urgent cares are up 37%, and our Kids Express, which is sort of more of a lower acuity, up 55%. This demand is absolutely creating a unsustainable pressure on our staff. Even if you don't think your child's going to get COVID or your child isn't going to get really sick from COVID, I guess what we really want to help people understand is that when our emergency departments, when our access points are this busy, it prevents the staff from timely addressing other needs that come into our emergency department, whether they be other respiratory diseases, concussions from Friday night football, asthma attacks, injuries, traumas. The emergency departments become slower. And in some cases, because of the wait, parents give up and they leave. And we call this leave without being seen. One day last week at Dayton Children's, we had 40 families leave without their child being seen. On a given day, under normal circumstances, we have zero children leave without being seen. This risk of children leaving without being seen in an emergency department is something that weighs very heavily on all of us, and we do everything possible to prevent that from happening. The reason for this surge is manifold, are certainly multifaceted, and our clinicians on this call can address that certainly better than I. We are seeing very high levels of respiratory diseases such as RSV, which impacts our small babies particularly. We're seeing a surge again in behavioral health. Unfortunately, as our children go back to school, behavioral health issues really rise again. All of this happened coincident with the opening of school unmasked. It correlates directly in the timing of schools reopening. Our staff is simply getting exhausted. They go above and beyond every day in every single one of these hospitals. They are some of the most compassionate and talented people this state has, but they're getting exhausted. They just don't see an end in sight. And they too have families who are being impacted by this. They have families who have children. They have children in school who are coming home either because they are getting COVID or they are being quarantined because they've been exposed to COVID. And that's impacting our ability to provide care. We've had a 4-fold increase of staff out because of illness, and about 93% of that is related to COVID. So when that happens, we don't have the staff we need here to address this really significant surge. So the question becomes, what can we do? The governor said it, and I believe there isn't anyone in this state who doesn't want to put our kids first. They are our most precious resource. So what can we do to protect our kids? And as Children's Hospital CEOs, as Children's Hospital clinicians, we believe very clearly, as we stated in our letter, that certainly if children can be vaccinated, if we as adults can be vaccinated, we need to be vaccinated. That is certainly an important way to protect our kids. And then from the perspective of our children, until this surge declines, until we can get back into some sort of manageable level of COVID, we really need our children masked in school. It's the only way that we can stop this surge and keep our kids in school 5 days a week learning, which is what they need if they're really going to thrive. It's also what we need to bring down the volume of demand for our services. We know this works. We know last year when our kids were in school and masked, we did not see this demand. We also know that masks do not harm children. They do not create illness in children, and that they are what will work. And I'll just share with you our colleagues up in Akron Children's. were able to review 1,070 kids from the Summit schools who were required to quarantine in since August 16th. Only 23 of them were from schools that there was no mask requirement. So of the 1,070 children that were required to quarantine, only 23 of them were in schools with no mask requirement. After Akron Children's was able to share that really stunning data, many of the schools in Summit County pivoted to requiring masks, and the quarantine numbers of kids in quarantine dropped 72% prior to the week before. So we know this can work. We know we owe it to our kids to make this happen. So we would just, again, urge all of our schools, all of our superintendents, all of our school boards to hear this data, to require masks in school for a period of time. I think we recognize this doesn't have to be forever, that as we see the incidence of virus decline in our communities, we can relook at this. But for now, the most important thing we need to do is make sure that our hospitals are available for every child who needs us and keep our kids in school. So thank you.
Thank you very much. We'll go now to Paula Grebe, who's the Chief Nursing Officer of Toledo Children's Hospital.
Thank you, Governor DeWine, and appreciate all of you being on this call with us this afternoon. Wanted to really take this opportunity to share much of the same information that you just heard so beautifully well spoken by Debbie. In the Northwest Ohio area, in the city of Toledo, at Ebide Children's Hospital, we have seen a significant increase in our inpatient and outpatient volumes for kids who have been sick, including kids with COVID. To share some perspective, our volumes inside the Children's Hospital have been over 100. Our average daily census has sat over 100 since the second week of July. That is unprecedented for us. Usually, volumes in the Children's Hospitals drop in the summertime months. We have seen a significant increase in the number of patients admitted with things like respiratory illnesses, RSV, parainfluenza. Again, those are wintertime processes that we see in our kiddos, usually sometime after November. Throughout the winter months, we have seen that consistently since July. We're running an average daily census of roughly 3 or so children now who are COVID positive. I think it's really important to point out in our geography at Ebide Children's Hospital over the course of the last 4 weeks, we have seen a steady and significant increase in the number of children who are testing positive for COVID-19. This last week, we've seen a total of a little more than 2,100 children who have tested positive for COVID, and the positivity rate for us is 12.7% of all tested. That's up significantly. Over the last 8 weeks, we sat about 2.5%. 4 weeks ago, we were at roughly 8% positivity rate, so a significant increase to 12.7% of our kids who are tested are now positive for COVID-19. As Debbie mentioned, we are being overrun in virtually all of our access points by sick children since the resumption of school for us in August or so. Our primary care physicians, our urgent cares, and our emergency departments are inundated daily. Certainly that holds true for all of our pediatricians in our Ebide Children's Hospital. But I will share, we had a very significant and very frightening event occur for us last night in Lucas County. At 10:36 p.m. last night, all of our Lucas County emergency departments went on EMS bypass. That includes Ebide Children's and all of our adult hospitals. What does that mean? That means that if a rescue squad was called for a 911 call and needed to pick up a patient and deliver them to a hospital, if that hospital is on bypass, that rescue squad is not allowed to stop at that hospital. Every hospital in Lucas County was on EMS bypass simultaneously last night. It's the first time it's ever occurred in any of our recollection of the last 30 or so years, unprecedented for that to occur. What happens at that point in time is our Toledo Fire and Rescue, our Lucas County EMS system, goes on what's called code red alert. And as every EMS call comes in, they are dispatched one at a time throughout the community to our individual emergency departments. What does that mean to our folks? That means that you don't necessarily go to the emergency department that's closest to your home or most likely suited to take care of your direct patient needs. It might mean that a 3-year-old who's in need of an emergency department that's specifically for pediatrics is delivered to a traditional ED because that's who's next in the queue. This is an unprecedented event for us, and one that's, as I said, a bit frightening for us, more than a bit frightening for us as well, because it speaks to the volume of sick people that are being managed in our systems as a whole. Certainly that impact included our Ebi Children's Hospital emergency department as well. That situation lasted for us in Lucas County for over 8 hours before we were able to alleviate some of the volume issues in 4 of the local hospitals, including our very own, to come off of bypass. Again, unprecedented for us to have ever been in that event, and definitely something that's very concerning for us as we strive to care for the youngest and the most precious of our resources. We know a path forward here to help alleviate the pressures that exist from the overwhelming numbers of patients being seen in access points. As Debbie said, and as you saw in our open letter from our CEOs from all of our state children's hospitals, we are asking for assistance from our schools and our communities to help us. If you have a child old enough to be vaccinated, please do so. As an adult, we should all be vaccinated. We know that masking works. You've heard some of the data, and we'll hear more as we lead forward. It's vitally important that we do these things to protect our children and really to find an answer to the overwhelming number and surges of patients that are being seen in our facilities across the state of Ohio. Thank you.
Thank you very much. We'll now go from Toledo to Columbus. Dr. Rustin Morse, Chief Medical Officer, Columbus Nationwide Children's Hospital. Doctor?
Thank you, Dr. DeWine. Governor DeWine, I appreciate the opportunity. I'll keep my comments quite brief. We are in uncharted territory across the state from a medical perspective, not just across the children's hospitals, but across the adult hospitals as well. The infrastructure to care for patients is being strained to a point where it's never been before. The staffing shortages are causing significant disruptions in healthcare delivery across the entire state, including children's hospitals. Couple that with RSV, respiratory syncytial virus, viruses we're not typically seeing in the summer months, as well as COVID. The children's hospitals are also quite strained. We are seeing record volumes here at Nationwide Children's Hospital. We have over 30 children admitted today in the hospital with COVID, 10 of whom are in the intensive care unit. And our emergency departments and urgent cares are seeing volumes that are over 1,000 a day across the system, which is probably 30 to 40% above where we should be. So we are asking for everyone's help to get vaccinated if you're eligible and to wear masks in school or in large gatherings as well. Thank you.
Doctor, thank you very much. Now to Dr. Patty Manning, Chief of Staff, Cincinnati Children's Hospital's Medical Center. Doctor?
Thank you, Governor. And I'll just reiterate what you heard the others share. Our numbers, our inpatient numbers, are the highest they've been during this entire pandemic for COVID positive children. Our ICU numbers are the highest they've been for this entire pandemic. Our children on ventilators with COVID are the highest they've been during this entire pandemic. Our emergency room and urgent care volumes and volumes in our primary care offices are equally overwhelmed, as you've heard across the state. That impacts the care of all children, not just children with COVID. We had an analysis down here in Greater Cincinnati of 7 school districts, some of which are partially masked and some of which are fully masked. And we were able to look at the difference between COVID positive children, so not quarantine children, but children testing positive for COVID, almost twice as likely to test positive for COVID if they were in a partially masked versus a fully masked school district. We feel like that, as well as many other examples that you've heard, is evidence for the efficacy and the usefulness of masks.
Doctor, let me interrupt you. I want to make sure I got it. Give me that figure again. You're comparing what kind of school versus what kind of school?
We're comparing schools that are fully masked, K through 12, with schools that are partially masked, just K through 6. And in the K through 6 districts, we had almost twice as many children test positive for COVID, not quarantine, but actually have COVID. And so that leads me to my final point and my final plea with you all, and that is that we have 2 paths forward. One of those paths to end this pandemic is one that many of you have asked about and many people have referenced, and that is, well, why don't we just let everybody get sick? To some degree, that's what we're doing right now. That's why we're all struggling. That's what we're all feeling the stress and strain of. So we could just let everybody get sick, including children. And for whatever reason, we put children out in front of us and let them get sick. Some of them will get very sick. Some of them might die. They will overwhelm our healthcare systems, and that will affect the care of all children in Ohio. That's one path forward. The other path forward is to use tools that are safe, effective. In many cases, they're benign. Wearing a mask is not dangerous to your health, as you've heard. And these tools minimize people getting sick, minimize children getting ill, having long COVID, minimize the strain and the burden on our healthcare system, and allow kids to stay in school. And I choose that path. And I plead with you as school leaders, as superintendents, as school board members, as community members who put lots of pressure on your school leaders. Please understand what we're asking you, and please do this small thing and allow children to be masked in schools throughout the grades, all the grades, and please get vaccinated. It means everything right now.
Doctor, thank you very much. Nick, you have anything else? And then we'll go to questions.
Go to questions, Governor.
Okay. We'll go to questions.
Governor, your first question today is from Jackie Borchard at Gannett, Ohio.
Good afternoon. Thanks, everybody, for your time. Governor, given what Dr. Manning just said, what you said earlier, that the data shows that COVID is spreading less in schools with mask mandates. The children's hospitals have asked schools to require them. This debate over mandates has been borne by local school boards. Wouldn't it help the school boards and the hospitals if you established a statewide mandate?
If I could put on a statewide mandate, if the health department could do it, we would do it. What the legislature has made very clear is that if we put on a statewide mandate, they will take it off. They have the ability to do that. There is no 30-day waiting period. They can do it right away. And the legislature has made very clear that if we put on a mandate for kids in school to wear masks, that they will take it off. And people say, well, Mike, why don't you do that? You could be on for a couple of days or whatever. And, but the problem with that is we're going to cause, if that happens, we would cause seems to me, a lot of confusion. And we might go backwards. We are over now, slightly over 50% of our kids in school, in public schools in the state of Ohio, are in fact under a mask order by the school. And we've made some progress. We've come a long way from the day that we actually started school this year, the days that school started. We need to go further. I believe that we will go further. We had this direct appeal today, a direct appeal from our children's hospitals who are seeing what's going on every single day with our kids. Their direct appeal to our schools, to our school boards, to our superintendents. And it was a compelling appeal. And in fact, that will be made available to anybody who wants to watch it. It lasted 1 hour. Nick Lashutka is going to make that available. I don't know whether, Nick, you have that yet ready to do, but we can tell people, we'll be able to tell not only the public, but obviously the media, and you can watch that. It was a very compelling case that they made, just as they just made a very compelling case. So this is, the legislature's made it clear to me, they will not hesitate, and they will repeal a mandate that I put on. And all that would do is cause a great deal of confusion. And then I think people would say, well, there's no mandate on, there's no requirement on, we can go back, there's really no reason to keep a mask on. So I'm afraid what would happen is we would slide backwards and we would go the wrong way instead of the right way. And so I'm counting, frankly, on the goodwill of our school boards, the goodwill of the people of the state of Ohio, when they hear the facts. And the facts have been laid out, I think, very, very clearly by our children's hospitals. I hope that I believe that when people of the state hear those facts from the children's hospital, that we're going to see more and more of our schools do what clearly is necessary, and that is to have masking in school. Doesn't have to be forever. Don't want it to be forever, but we are at a crisis right now. We are at exceedingly high numbers right now. They are not going down. And as Children's Hospital has made very, very clear, it's not just children who have COVID who are threatened. It is any child who's in an accident, any child who's got any other medical problem. The ability of these hospitals to care for these children has been really compromised.
Next question is from Joe Ingles at Ohio Public Radio and Television.
Hello, governors, and thank you, Governor DeWine and doctors for doing this. Governor DeWine, that being said, half of the schools don't have a mask policy. They have heard this appeal before, over and over and over. They don't believe the numbers. A lot of people don't believe the numbers. They don't believe the problem is as bad as you're saying it is. Oh. So the thing is, if that's the case, there's absolutely nothing you could do, including going to court or taking some other action. Is that what you're saying?
That's what I'm saying. I vetoed the bill that gave the legislature this power. That veto, as you well know, because you reported it, was overridden by the state legislature. In addition to that, the state legislature has made it very clear to me that they will take off a health order if I put a health order on. Now, look, if there's a change of opinion in the legislature, I am happy to put this order on. I will take the responsibility for it. I did not hesitate last year to take responsibility. I'm not going to hesitate again. But that's not where we are. That's not where we are today. And look, I think there is new information. What you heard from the doctors today are two different examples. I think the example from Dr. Patty Manning, Chief of Staff in Cincinnati, and she talked about a group of schools where there was a partial mask mandate on, and she compared it to what was going on with a school where there was no mask mandate on, not a complete mask mandate, just a partial one versus none. And it was clear in the evidence that she put forward that the kids in the one where there was only where there was no mask mandate are twice as likely to get it as when they had a partial. That's pretty compelling data. The data we're looking at that I cited earlier, statewide, even though it's still early, it clearly shows that as well, that there's a fundamental difference between kids getting it in a school district where there's masking versus where there's not masking. So the evidence is coming in is very, very strong. And again, I would say that when we have talked about this for the last 18 months, one of the things that people who don't want masks, people who sometimes are skeptical about the data, one thing that they have said is, well, when hospitals fill up, I know that's a problem and we will act. What you're hearing today is hospitals are filling up. And it's a threat not just to your child if your child has COVID. It's a threat to your child if that child is an auto accident or any other problem.
Next question is from Danny Eldridge at Hannah News Service.
Hello, Governor.
Danny?
So my question is, why not put the mask mandate on, let the legislature take it off, and then take them to court and get a restraining order, keep the mask mandate on? I mean, isn't that a possibility? Or do you think that this law is unquestionably constitutional?
Well, I don't think anything's unquestionably, but again, I have to weigh, and I have I don't have a hesitancy. You've watched me. I don't have a hesitancy of doing that, but I have to weigh the damage that would be done by that and the turmoil that would be created and the fact that I think it's very likely that we will roll backwards. What I'm hoping is through this contact today between Children's Hospital directly and answering directly questions from superintendents. And they've made this offer also today to do this with all school boards, where school board members can get on, or anybody in Ohio, school board members or anyone else can pull this up later today and watch that hour. And it's a compelling hour. So I believe that we're now over 50% of our kids who are in masks in our schools. I believe that with what the conversation that took place today, that we can keep that number going forward. Look, we saw several schools in the last 24 hours. I just saw on the news media, Troy, Ohio, for example. They voted last night and went to a mask mandate. Look, nobody wants to have masks in schools, but I think people are realizing when they look at the facts that this is the only way we're going to keep our kids in school. This message is, I think, very compelling, very strong. If we want our children in school, then at least during this huge COVID Delta variant that's overwhelming our hospitals, wear a mask. That's the way we can get through this. We can keep our kids in school. We can keep our hospitals from being overwhelmed. I think it's a compelling case. And so I'm not giving up on that. We've been successful. We've moved the ball. Look at where we were on the day that school started, or the days that school started in Ohio. We have dramatically increased the number of schools that are requiring masks. It's a phenomenal change. I think we can keep that momentum going.
Yeah, Governor, this is Nick. Maybe just to add on to that, our clinical leads, our teams, working very actively locally with school boards, school districts, and others. We're committed to going down this path with our school officials. They're responsible for kids. We're responsible for kids, and we are prepared to continue, sharing the information that you've heard today. And Governor, as soon as that link is available from that superintendent meeting, we'll make sure that that's available to the media or anybody else who would wish to see it.
Great.
Next question is from Bennett Wise at WKEF in Dayton.
Hi, Governor DeWine.
Bennett.
So you've
Yes,
made
sir.
it clear that it would be hard to reinstate any health orders, even in school systems. We have some districts here in the Miami Valley that are leaving quarantine decisions up to parents if a student is exposed to COVID-19, regardless of the student's vaccination status or if a mask was worn. We have one district in Miami County that says public health is telling them to leave it optional due to confusion over state law. So ultimately, is there anything you can do or will you do to direct local health departments to enforce quarantines for exposed students?
Local health departments have a legal obligation to do that. Dr. Vanderhoff, you want to take that?
Yeah, it's evident from the data, the information that our pediatric colleagues have shared with us this afternoon, that COVID-19 is raging. It's raging across every community in the state. One of the most proven and fundamental tools for dealing with a raging infectious disease, especially one like COVID, that is landing people in the hospital in unprecedented numbers, is quarantine. Quarantine is an essential public health tool. And so it's incumbent upon communities working with their local health departments to take quarantine very seriously and apply it as we've guided. Now, we've been very sensitive to the importance of applying quarantine in a way that helps to ensure as many students can stay in school as possible. And that is why our quarantine guidance offers pathways that recognize the power of vaccination, that recognize the power of masking, and provides ways that students who have been vaccinated or who are wearing masks actually can remain in school. So very important tool, and one that we really need all of our community leaders to be taken seriously.
Next question is from Laura Hancock at cleveland.com.
Hello, I was just wondering if you could provide some advice. I know a mom of a second grader who is one of 3 kids in that second grade class to wear a mask, only 3. The teasing has already started. If other parents aren't interested in protecting this little girl enough to make their kids wear masks, then, why should she be subjected to teasing to wear a mask to protect them? Like, what would you say in that kind of situation?
Well, I would hope that the school officials would understand the situation and would take action and require everybody to wear a mask. That's how you solve the problem. Now, I'm not trying to minimize, the situation for that little girl. I mean, I think if that was my girl, my little daughter or my granddaughter, how upset that I would be, and I would certainly want to protect her from that. So I'm not minimizing that. It seems to me, with all the evidence that we have out here, I would hope that school would rethink that and would rethink their position and take the position require everyone to wear a mask. Look, what we learned last year is that kids are very adaptable, and when everybody's doing it, they're fine with doing it. They will wear a mask. And we're not asking schools to do this forever. We're simply saying we have this crisis and we need to get through the crisis. Well, there's two differences. The first difference is last year everyone was wearing a mask in school, and this year, children are not wearing masks in many, many, many schools. Second is the Delta variant, and we're told by the health experts that the Delta variant is much more contagious. So that's what the difference is. But my heart goes out to any child who's being bullied in any way.
Next question is from Scott Hallis of the Xenia Daily Gazette.
Hey, Scott.
Hey, Governor, how are you?
I'm well, sir.
Good. This might be a better question for Dr. Vanderhoff or one of the hospital representatives, but there's a lot of people out there saying that, it's not safe for kids to wear masks for several hours a day, that there's long-term health effects, there's issues with that, and there's a lot of parents who are concerned about that. Is there any science out there to the contrary, that, wearing a mask for 6 hours a day in class with a few breaks here and there, is safe for the short term and in the long term?
Yeah, we're going to go to Dr. Vanderhoff first, and I think Dr. Manning also. I heard her earlier comment on that. If I'm wrong, it was one of the doctors. So we'll go to you, Bruce, and then we'll go to Dr. Manning.
Thank you, Governor. The American Academy of Pediatrics has spoken very clearly and very strongly on this issue and indicated that the scientific evidence actually points to the safety of masks, and that not only are masks safe in our children, they're well tolerated. And Governor, you're correct. My recollection is as well that Dr. Manning has spoken about this before. Dr. Manning, would you care to add anything to that?
Sure, thank you. I'll add, I'm going to speak as a developmental pediatrician, somebody who specializes in child development and behavior. And I can promise you that the claims that masks impact children either physically or emotionally, behaviorally, socially, are simply false. Children tolerate these masks very well. In many cases, they tolerate them better than the adults in our lives. And many of us have examples of being exposed to children here in the hospital or in the community and realizing that it's often not the children who are complaining about the masks, it's the adults in their lives. And so this is one of many times when we could actually follow the lead of children and do what's right. I think they know what's right, and we need to provide better models for them.
Next question is from Marty Schlayton at the Ohio Capitol Journal.
Governor.
Afternoon.
So if the legislators who passed the bill constraining your ability to issue health orders and overrode your veto have put you in this position, would you say that they're partly to blame for the fact that we've got children lying in ICU beds in such numbers and that Lucas County had its emergency rooms overloaded yesterday?
Well, I am an optimistic person, as you know. I've said that, and I think you know that I am. It was interesting today that on call, there were questions or comments about whether or not this information has been shared with the state legislature. And we were encouraged to share that information. And that was some of the attitude of some of the members, some of the superintendents, people, school officials who were on the call. So look, we're going to continue to do that. when we do a press conference like this, obviously we're sharing it with everybody Ohio, which includes members of the General Assembly. And I think that, again, I'm optimistic that as people learn the facts, that they will, take a look and maybe reevaluate what their position is. But we have some momentum going. We're getting more schools that have decided, at least for a period of time, to put the mask on. And we hope that this press conference today and the meeting that we had earlier today, the virtual meeting with many school superintendents all over the state of Ohio, will not only impact those superintendents, but there'll be other superintendents and other school officials and school board members who will watch this as well, and that there'll be members of the legislature who will watch it as well.
Governor, just to add on to that, we've shared this with the superintendents, but all of our children's hospitals are in regular communication with the 132 members of the Ohio General Assembly in both the House and Senate. And as we speak, we're reaching back out to them as these data that you've heard today and last week continue to evolve, so that they're not only hearing firsthand the information that we're sharing with you, but I think importantly have the opportunity to ask questions of our clinical leaders, because what we're finding is there's just a tremendous amount of misinformation out there in the public. And, I think as we have these conversations, I'm a real optimist too. We're finding that people are responding to that. So that's an effort that we're going to continue as well.
Nick, let me also add that this is a state legislature that in 2 straight budgets at our request has overwhelmingly added additional money, significant money for children's health issues. Everything from doubling the amount of money going to local children's services to putting more money to deal with the lead paint problem, and I could go on, and early childhood development. So this has been a legislature that has put money where we've asked them to do it, and they've done it in regard to children. They have focused a lot on children. So I still have hope. And again, I think sometimes there's a lot of misinformation out there, and our job is to do everything that we can to get the information out.
Next question is from Jim Oddie at WHIO in Dayton.
Hey, Jim.
Hey, Governor, I wanted to see if, to what extent you might believe that there is a potential path around Senate Bill 22. Could that be done by the duly elected State Board of Education? Could that be done by county commissioners at the local level? Could it be done by a duly elected mayor of any particular city to have their schools be masked, or any other restrictions that might help in this situation? Or perhaps not. What do you think?
Jim, we don't think we have any avenue around this. Those others maybe are possibilities. I don't want to be play lawyer here without doing any kind of research. We know that there is some cities that have taken some action in this regard. So there's other possibilities out there, but we don't think that there is any effective way to do a statewide order that will accomplish what needs to be accomplished. So, look, I've been involved in government politics for a long time, and what I have learned is that the goal, you have a goal. What is your goal? And you shouldn't lose track of what the goal is. Because of the horrible situation we are in for a period of time, we think the goal should be, and we know the goal should be, the same as what children's hospitals said it should be, and that is we should have children in all our schools, public and private, parochial, everyone, with the kids wearing masks until we can get out of this horrible, horrible situation that we are in. We are making progress in that. What I'm hoping is that today's press conference and meetings that took place between the superintendents and the children's hospitals can keep that momentum going, and that we can go from 53, 54% wherever we are today, and that we can continue to move that up. We're in a lot better position than we were before when school started. We just have to keep going. So my goal is going to be to try to get there maybe a different way than we would have liked. Maybe not the easiest way, but we're going to try to get there. We got to protect these kids. We got to keep kids in school.
Next question is from Christian Hauser at WKRC in Cincinnati.
Hi, this is Mike Worsley. I apologize, Christian. I had to do a live report, but you did want me to ask, Governor, given that you say that this is a crisis and it's only getting worse, and you're worried that if you implement a statewide ban, it will be overridden by the legislature. Christian was wanting to know, why are we letting politicians dictate the health of our kids and of our population?
Look, we're a country of laws. Laws get passed. Sometimes we like them. Most of the time, I guess we like them. Sometimes we don't like them, but we're a nation of laws. And so, what happened was that the law that was passed, I vetoed, as I have every right to as governor of the state, because I thought it was not in the best interest of people of the state. The legislature, in their wisdom, decided to override the veto. That's where we are today. They have overridden the veto, and they've made it very clear that they would not allow a health order that required masking. So that's where I am, and I'm not giving up, and I'm not, just walking away and off the playing field. What I'm saying is, look, if we couldn't get it done that way, let's get it done another way. And the other way is to, frankly, convince school boards and superintendents across the state of Ohio that for a limited period of time, at least during this crisis, this is something that's very, very important and that we need to do it. And if we want our kids in school, which we all do, this is the way to do it. So if you can't go one way and get something done, I've learned, try to do it and get it done another way.
Thank you.
Next question is from Justin Dennis at MahoningMatters.com.
Good afternoon, folks. Hi, thanks for taking our questions today. I'd like to address the medical professionals on the call today and ask if they feel that a statewide mask mandate in schools is the correct path forward, or is it better to rely on, as the governor said, the goodwill of local school board officials to make this choice for themselves, knowing that in some cases, some officials, some parents, some local legislators may see it as a heroic deed to refuse this or something that's to be applauded. I'd like to see what they think about that.
This is Nicholas Shutka from the Ohio Children's Hospital Association, and we are children's advocates, and we are passionate. We use the best information we have to make recommendations to policymakers about what that best pathway forward is. And as we've talked with legislative leaders and continue to talk to rank and file members of the General Assembly, we've heard the same message that the governor's reiterated with you here today. And we would be worried that perhaps there would be an unintended consequence where any district who has already taken a measure to move forward with a temporary mask requirement could be unintentionally forced to have to remove that. We're in the business of protecting kids, and we're optimistic, and we believe that as we continue to share these data and what we're seeing firsthand, that people will do the right thing. Debbie, I don't know if you want to add anything to that or pass on it, but I know you and I have talked a lot about this over the last several days.
Well, I would just reiterate what you said, Nick. I think as children's hospital leaders and medical professionals, it's incumbent upon us to speak out and say what we know is the best thing for kids. And the best thing for kids right now is for them to be masked in school, all of them. The realities that we're facing in our state are making a statewide mandate a difficult thing to put in place right now. So what the governor's doing, and I applaud him for that, is saying, let's not just throw up our hands and say we can't do anything. Let's get the information out. Let's keep communicating. And that's what we're all committed to do. And we're actually feeling better that we're seeing the kind of progress we are that the governor shared today. But as children's hospital professionals, it is absolutely incumbent upon us to say that children need to be masked in schools.
Next question is from John London at WLWT in Cincinnati.
I was really struck by Dr. Manning when she referenced how there's a viewpoint out there of just let this play out, but run its course, and that's kind of what is happening now. And the governor is saying you've got momentum going. You recognize the power lies with the legislature. You're making the direct appeal. Dr. Lashukla was saying that you're in touch with all the legislators. Dr. Manning, what is your read on today's session with school superintendents? Was there a back and forth? Did they say, yeah, we got to do this, or there's some giving reasons that they're not going to do it? What was your sense of this?
Thanks, John. My sense is that everyone hears the urgency in our voices and wants to be supportive and responsive to the needs of children, but that we're feeling a little caught in where we are as a state. And, to the previous question, I would say, as children's hospital leaders, we have our hands full managing the tsunami of kids that have come our way. And we look to any leaders in the state or in the school districts to do what we're asking you to do to help us. So I probably can't say more than that, other than I think it's frustrating to be in a place where everybody seems to want the same thing, which is the health of children and for children to be in school, but to not know how to get there. It's also frustrating to feel like that the will of a smaller, maybe a minority of people is trumping the rights of the majority of people, and certainly of children, to be safe and free from risk of infection and disease.
Next question is from Chris Serenelli at WFMJ in Youngstown.
Governor, thank you for taking my question. You've effectively said that the legislature has tied your hands here, but you did indicate that there were some possibilities as far as how to move forward. What is the next step? Are you going to go back to the drawing board? Are you going to hold some meetings with some of these stakeholders here and figure out some of these possibilities? And if so, when?
I think the most powerful voice in all of this, the voices, are the voices of our children's hospitals. They're the ones who every single day are taking care of our children. And I will make this personal. Fran and I have had children in Dayton Children's Hospital. And when your child goes into a hospital, the most important thing in the world for you, the most important thing, is for them to take care of your child. And the thought that we have children who are going in children's hospitals today with any number of problems, and they're having to wait a significant period of time, or they can't be seen at all, I think is just gut-wrenching. And as a parent, as a grandparent, I don't want that for I didn't want it for my children when they were young. I don't want it for my grandchildren. And so, I maybe get a little emotional about this, but that's what's at stake here. It's the children who are getting COVID and the children who are getting sick from COVID. It's also anybody else's child who gets any other problem. And again, Fran and my experience, we've had experience with a young baby who we didn't know what was wrong with her. And, we wanted them to act quickly, and they did. And the thought that they would not be able to act is it's horrible. That's what's at stake. And I think the children's hospitals, you asked me what else we can do. I think having children's hospitals speak out as strongly and as clearly and as consistently as they have in the last 2 weeks, is certainly one of the reasons we're seeing more children in masks going to school. And I would, again, make an appeal. Even if your school does not require a mask, you can have your child wear a mask. Not maybe as good as having every child wearing a mask, but you can do that as a parent. And I certainly would do that as a parent.
Thanks, Governor.
Next question is from Tom Jackson at the Sandusky Register.
Hey, Tom.
Hi, Governor. Thanks for taking my question. Governor, could you clarify why you criticized President Biden for issuing a mandate on vaccinations? Why, for example, shouldn't hospital workers who treat vulnerable patients be required to get vaccinations?
Yeah, I thought it was, I said it was a mistake. I think it was a mistake because it plunges us into more of a political debate, which I think clouds the science and clouds what we're trying to get accomplished. I think I'm consistent. I have opposed bills in the state legislature that would tell our hospitals that they could not require vaccinations, would tell our nursing homes, tell everybody, every employer, you can't require vaccinations. Government shouldn't be doing that. On the other hand, look, there may be situations where a health entity, hospital, nursing home, wants to make a decision to require everyone to be masked, but they look up and say, I can hardly keep my place open today. So to have the government come in and say you can't do masks, or you must do, or excuse me, you have to do vaccines, or you can't do vaccines, I just think is a mistake. And I think it gums up the works as we try to stay focused on what we need to stay focused on, and that is the science behind vaccinations. We're still vaccinating people in Ohio every day, about 10,000 people on the average, who in the past have refused to get vaccinated. So let's just stay focused and stay focused on the science and not get this into this, the politics of all this. That was my take on it. That's all.
Next question is from Richard Solomon at WBNS in Columbus.
Hi, Governor. My question is, when is enough enough? Something that resonated with me that Dr. Manning said is right now we're on two paths, and one of those paths is to continue to let people get sick. When do you think enough is enough, and that you will step in and do something or mandate something?
If I knew anything else to do, I would have done it. I'm doing what I can do. And I think sometimes, what a governor can do is convene people, put people in a room together. A governor can call on experts, and they come forward. And that's frankly what I did today. We asked children's hospitals, will you organize this? Will you talk to the school superintendents? We have many school superintendents are calling children's hospitals anyway. Let's put them together. I'm a believer in facts. I'm a believer in if people have the sufficient facts, they by and large make the right decisions. That's been my own experience in my own life. And so, what a governor can do is what I did today, and convene that together, put them together, have them talk. As I said, there was a discussion about maybe doing the same identical thing with our children's hospitals for our school board members. Look, these people are in a difficult situation. They're being tugged one way and tugged another way. And they don't get paid a whole lot to be on a school board. And these are tough jobs. And a school superintendent during the pandemic is a tough job. So trying to get them the facts, I think, is important. And that's one of the things that I can do.
Thank you, Governor.
Next question is from Luann Stoya at WSYX in Columbus. Next question is from Jenna Borthwick at WEWS in Cleveland.
Hi, Governor. The mask debate has been going on between not only you and the legislature, and of course going on at these school board meetings more locally. I know our local Board of Health here in Cleveland said that masks and distancing 3 feet apart is the key to kids staying in school. And at these school board meetings recently, there's been a lot of tension between parents and health officials. So I guess, how would you advise school boards to deal with some of this tension and make the decision going forward about mask wearing when you have an overwhelming majority of parents, not wanting to wear masks, and then of course going based on your guidance and the Departments of Health guidance?
Yeah, I don't minimize how difficult it is. I've talked to some school board members who are in a very difficult situation. As I said, these people, they volunteered because they care about kids and they want to get in there and they want better education for their kids and for everybody else's kids. And now they're stuck with the pandemic. So I get it. I understand. They're going through hell. And, you have people with strong feelings on both sides. So I get it. But I think, my job is to try to get the information into them And what the children's hospitals did today, I think is helpful. I hope it will help our school boards make these decisions because I know that members of the school board want nothing more than the best interest of those kids. They want to keep these kids safe. They want to keep them in school, and they want to keep them moving forward. And I think that in some respects, the most compelling argument is this. It is abundantly clear by what we've seen in the first 2-3 weeks of school that the way you keep kids in school is to keep them masked. Vaccinate them if they can be vaccinated, if they're old enough to be vaccinated, 12 and above, and if they're not vaccinated, have them wear a mask. Look, we have a long way to go. If you look at the numbers, I don't have it in front of me, but if we look at the numbers of our 12, 13, 14, 15, 16, 17, 18-year-olds who are in school, the percentage of those that are vaccinated is not very high. So we've got a long way to go even with that group where the vaccine is already available and they're eligible for it. So vaccinations, more kids getting vaccinated, and then, if the kid is not vaccinated, wearing a mask. But I feel sorry for the school boards. It's tough. It's tough. If I could take this away so they didn't have to make those decisions, and so that they wouldn't have that pressure. Some people have said to me and superintendents, "I wish you would make the decision." I said, "Look, I can't do it."
Thank you.
Let's go back to Louis and Stoya at WSYX in Columbus.
Thank you for taking our questions, Governor. I would like to address the Buckeye games that we've been seeing. We've had 100,000 people in Columbus last Saturday. We've got another 100,000. Is this a super spreader event? There are adults and children at these games. Granted, they are outside, but people are sitting on top of them. Maybe this is a question for Dr. Morse or for the state health director, but is there a concern over that and any discussion about whether that should continue, whether the games, those live games, another game tonight with the crew?
Sure, I'll let Dr. Vanderhoff do the science on it. I'll just tell you that, Fran and I went to the game, tough game. We both are fully vaccinated and we both wore masks. So, if I was going to, this is just me, I can just tell you what we do. If we're going to go to a Buckeyes game, we're already fully vaccinated and we wear a mask. If I was not vaccinated, I wouldn't go. And even if I was vaccinated, I would wear a mask. Dr. Vanderhoff.
I think the governor covered it very, very well. We know that our vaccines are very, very effective. And when we are in crowded environments, even when we are vaccinated, it's a smart idea for us to add that additional layer of protection, which is wearing a mask.
And again, the thing that, that there is a difference outside, inside, there's just a difference. It's safer outside than inside generally, but I would be cautious. I mean, that's what Fran and I are. I try to be cautious, but if somebody's not vaccinated, they're not old enough to be vaccinated, or they're not vaccinated, I wouldn't go.
But are we concerned that this potentially could overwhelm our hospitals even more than they already are?
Yeah, I'm going to leave that to the medical experts. I don't know if anyone else wants to take that, but I've exhausted my knowledge here. So
I'll just join in that sure, any large event with crowds places individuals at risk. We learned over the past year when that happened and when it didn't. I think a combination of vaccination rates and some safe practices make those events maybe safer than they might have been in months prior. But I follow the governor's lead. If I were to go to an event like that, I would wear a mask. I'm also vaccinated, and we would encourage others to do the same.
And this is Dr. Vanderhoff. I think the governor also made another very important point, and that is when we are outdoors, our risk is considerably less than when we are indoors. And it is very clear from at least the guidance that I've seen that the OSU Buckeyes have given clear guidance when the fans are there and in enclosed spaces, they are asking that they be masked.
Next question is from Luis Gill at Ohio Latino Television.
Luis. Afternoon.
Hello, Governor. How are you?
Well, sir, thank you.
Thank you for having this, Governor, and thank you for all the people that are here, professionals. And also, you call yourself that you have been in politics for a long time, so you are a professional politician. My question is, Governor, it's a long one. There's a reason to believe, Governor, that some superintendents, some principals, some school board members, and teachers have overreached into education of the children. And what I mean by that, through Zoom, a lot of parents learn what the actual kids were learning at school. And they saw, and some parents were appalled of what they actually were teaching. And what I mean by that, things come in indoctrination, ideology, sex education, CRT. And I don't mean to make this a political question, but the masking and vaccination is paying a price because the parents no longer trust superintendents and principals and the school boards what they're trying to do to the education in Ohio. I believe, some parents believe the consequences is being paid right now. More parents are involved, like Jenna said earlier. The school board meetings are full capacity. Some people are just, before the vaccination with the virus, school meetings were attended only by, 3 or 4 parents. Now it's full capacity and no longer. So the consensus from the parents is the best thing for the kids is a decision that the parents will make. So there's a complete division, Governor, into this. And I believe that what you're trying to do is not taking in a way that you wish it to do, because the superintendent and the school boards have made so many changes into the education and no longer believe that they're making the best decision at this time.
Well, let me answer it this way. First of all, we have some great teachers. We have some great school administrators who, care very, very passionately about these kids. They've had a very tough time during the pandemic. I joke with some of my superintendent friends, there couldn't be a tougher job than being superintendent during a pandemic, or a principal or a teacher. My hat goes off to them. We live in a state where we have over 600 local school districts, over 600 school boards. These school boards, as you know, are locally elected. And we do see people becoming involved in wanting to find out what their kids are learning, what is being taught in their schools. Those are healthy things. People have every right in a public school to go in and to, look at what's being taught, make their own judgment about it. And if they don't like it, show up at the, next school board meeting, or talk to the superintendent, or whatever way they want to, exercise their rights of citizenship living in that school district. So, if you look at what's happened in Ohio in the last few years, it's not just been people going to school board members, or going to school board meetings about COVID or about masks or anything else. So we've seen that, certainly, and we continue to see that. But there's also many other issues that people, go to their school board to express. And I think as long as that is done in a constructive way, in a polite way, people have every right to do that, and should be encouraged to do that. You have a right to know what textbooks your children are reading. You have a right to know, what is being taught in the school. And in Ohio, we believe in local control. I mean, it certainly is a partnership with the state, but basically, we elect locally our school board. It's the people in the local school district who elect the school board, and that school board is then accountable to those people. And so it's democracy at work. It's our Republican form of government works that way and works well. And so, I think that's part of what we do in Ohio. And I think that's overall is certainly a good thing. So thank you.
Thank you. Thank you, Governor.
Governor, next question is the last question for today, and it belongs to Jeremy Kelly of the Dayton Daily News.
Hi, Governor.
Jeremy.
Luis just talked about more people going to school board meetings, and Dr. Manning talked about a vocal minority having an outsized impact on the public debate. There are lots of people, I've talked to many of them, who want no part of those school board meetings because of the drama and the anger and the name calling that's going on. What advice would you give to everyday folks who might very well agree with what you're saying or what the doctors are saying, but have kind of stepped back and haven't been part of the debate?
Well, I think it's always important to let your elected officials know what you think. I hear from people every day, and I think that's part of the process. And your school board members are elected. I think it's also important to do it in a civil way, to do it in a way that does not discourage other people from coming forward and being part of the process. I think anytime that we can encourage people to be part of our democratic process, it's a good thing. So I think encouraging people to do that, if you feel that, you don't want to get involved, but you feel strongly, you can certainly send a letter. That's important. A well-written letter can be, much more persuasive sometimes than a personal appearance. It just depends on the letter. So I think there's many ways that people can participate in our government, writing their legislators. But if we're talking specifically about schools and what sometimes this year has become very contentious, I would just, say to everyone, exercise your constitutional right, make your opinion known, but, try your best to do it in a civil way that is respectful of the people making the decisions and respectful of people who are in the same room who are, against what you're saying. So I guess that would be my advice. Well, thank you all very much. I want to thank the children's hospitals. Nick, thank you for doing that. I don't know if you can tell everybody how you're going to post that. So if anyone wants to go back and watch that hour, that would be good. And I'll let you close it then.
Thank you, Governor. We'll make that available through your comms and media team, through Brianne, once that link is available. And that's all I have.
Okay. Thanks, everybody. Appreciate it.